plant compounds may be effective alternative treatment for rosacea, new review. More than 5% of the world's population is struggling with rosacea, a common skin disorder that is unresponsive to traditional treatment or is typically managed with drugs that cause unpleasant side effects. A peer-reviewed paper recently published in Pharmaceuticals shows botanicals derived from certain plants may help address the condition's underlying causes to better manage short and long-term symptoms. Researchers reviewed a comprehensive list of studies on rosacea in scientific databases from February to September 2023 and identified numerous active botanical extracts and pure isolated phytocompounds with anti-inflammatory, vasoprotective, antioxidant, and antimicrobial properties with promise in managing rosacea. Although existing clinical studies focus on addressing symptoms instead of the disease itself, the authors said using natural plant compounds to manage rosacea, alone or in combination with consecrated drugs, could be more effective and bring millions relief. What is rosacea? Rosacea is a chronic inflammatory skin condition that mainly affects the forehead, nose, cheeks, and chin, characterized by flushing, persistent redness of facial skin, inflamed bumps, or thickened skin. People with rosacea may also experience itching, burning, or stinging. The condition is more likely to affect people who have fair skin. It may appear earlier in women and is more likely to develop on the nose in men. The pathophysiology of rosacea is unknown, but research suggests the condition may involve various inflammatory and immune-mediated processes, genetic factors, vascular dysfunctions, oxidative stress, and neurogenic inflammation. Rosacea currently has no medical cure and often requires long-term treatment, leading many to turn to natural compounds to manage the condition. Currently, rosacea treatment includes topical agents such as azelaic acid, metronidazole, or sodium sulfacetamide sulfur, oral antibiotics, laser therapy, and medications such as isotretinoin. Doctors also recommend making lifestyle changes and avoiding common triggers that could make symptoms worse. According to a survey by the National Rosacea Society, the top 10 triggers, based on responses from 1,066 rosacea patients, include sun exposure, emotional stress, hot weather, wind, heavy exercise, alcohol consumption, hot baths, cold weather, spicy foods, and humidity. Other triggers included cosmetic and skincare products, medications, fruit and dairy products. Plant compounds that may help rosacea. The medicinal parts of plants, or botanicals, have been used in skincare worldwide for centuries and provide alternatives to standard treatments and prescription medications with adverse side effects, researchers said. They can also work synergistically with medications to reduce side effects and enhance their therapeutic benefits. Below are examples of natural compounds researchers found could help manage rosacea. Although some botanicals have not been studied directly for rosacea, the researchers noted that they have been shown to address symptoms commonly associated with the condition. Licorice root. According to the paper, various forms of licorice in higher quantities have both anti-irritant and anti-inflammatory properties that may alleviate symptoms of sensitive skin, erythema, inflammation, and itching commonly experienced with rosacea. Another anti-irritant form of licorice has been shown to help with mild to moderate facial redness. Indian chrysanthemum. Indian chrysanthemum may play a significant role in how rosacea develops, progresses, and resolves. The researchers said parts of this plant contain a unique combination of saponins, phenylpropanoic acids, and flavonoids by increasing the mechanical resistance of capillaries. In one study, patients who applied a cream containing Indian chrysanthemum twice daily showed significant improvement in skin redness and rosacea severity. Colloidal oat. Approved as a secure and reliable skin protectant by the U.S. Food and Drug Administration in 1989, colloidal oatmeal is a soothing agent used to relieve itchy, dry, and irritated skin. These finely ground oats contain ferulic, caffeic, and coumaric acids, flavonoids, vitamin E, and polyphenols called avenanthramides that give them antioxidant, ultraviolet absorbent, anti-itch, and anti-inflammatory properties. Bitter wood. Bitter wood is a small tropical tree that contains anti-inflammatory phytochemicals. In an open-label study, 30 patients with rosacea were treated with a topical gel containing 4% bitter wood for 6 weeks. Results showed significant improvement of telangiectasia, small widened blood vessels on the skin. It also inhibited inflammation and nitric oxide production, which is known to increase vasodilation. Feverfew. Feverfew is a well-known medicinal herb with anti-inflammatory, antioxidant, and anti-irritant properties. According to the authors, feverfew plays an important role in inflammation, immunity, cell proliferation, differentiation, and survival. The herb was found to reduce irritation from shaving, protect against UV exposure, and improve facial blotchiness, flushing, and skin roughness. Wormwood. Over 1 million patients have used wormwood for its therapeutic safety and effectiveness. According to the paper, the benefits of wormwood can be attributed to its strong anti-inflammatory properties and ability to kill microscopic parasites that live on the face and cause skin problems. Experimental studies show wormwood has anti-angiogenic properties, meaning it can reduce the growth of new blood vessels. Additionally, data show wormwood may have comparable effects to a common antibiotic and antiprotozoal used to treat rosacea. Chamomile. Chamomile contains volatile oils and other properties that inhibit certain enzymes and regulate T helper cell activation and histamine release. A T helper cell is an immune cell that senses infection and then activates other cells to fight it. Although chamomile may induce allergic contact dermatitis in those with sensitive skin, recent studies show applying it topically may help atopic dermatitis and skin irritation. Tormentil. Tormentil is a perennial plant in the rose family that can constrict the small, widened blood vessels experienced by those with rosacea. In a 2020 study published in the Iranian Journal of Pharmaceutical Research, tormentil was shown to increase collagen and alter oxidative events in diabetic rats. Green tea. The green tea plant contains antioxidants and catechins, natural polyphenolic phytochemicals that have been shown to initiate cellular responses in the epidermis and decrease UV-induced redness. According to the paper, green tea may be helpful in treating rosacea because UV radiation can trigger the condition. Other studies show chemical compounds in green tea may inhibit the formation of new blood vessels associated with rosacea. Artemisia levandulifolia L. Artemisia levandulifolia L. is a perennial herb with antimicrobial, antifungal, insecticidal, anti-inflammatory, and anti-angiogenic properties. In a 2022 in vitro study in Biomedicines, researchers evaluated the effects of 2 bioactive constituents in this herb, isochlorogenic acids A and C, on the dysregulation of vascular and immune responses to rosacea. They found both suppressed the inflammatory response mediated by macrophages and mast cells. Isochlorogenic acid A has also been shown to be protective against UVA radiation. Yuzu citrus fruit. Yuzu is a common citrus fruit in Asian countries that is rich in antioxidants and has been shown to have an anti-inflammatory effect on the skin. Citron essential oils may suppress pro-inflammatory mediators involved in the development and progression of rosacea and could help normalize the innate immune response, improving symptoms of the condition. Yarrow. Yarrow is a popular plant with phytochemicals, such as flavonoids, phytosterols, phenols, terpene, and essential oils. Yarrow extract contains anti-inflammatory properties that may reduce inflammation caused by cytokines. Researchers said studies on yarrow show it can soothe the skin, balance pH, and reduce redness, in addition to inhibiting the inflammatory process. Coffee berry. The coffee plant contains numerous antioxidants and polyphenol compounds that protect against UVA and UVB radiation, which can prevent damage caused by oxidative stress and free radical exposure. Although oral caffeine consumption was once thought to be a trigger for rosacea, more recent studies show that it may do the opposite. In one study, caffeine was shown to suppress cells that cause inflammation and skin damage through a mediated autophagy mechanism. Autophagy occurs when the body removes damaged cells and replaces them with new ones. Aloe vera. Aloe vera has been extensively studied and is known for its wound healing properties. In numerous studies, the plant has been shown to possess anti-inflammatory, pain-relieving, and anti-itching properties. According to the paper, aloe vera's antioxidant, anti-inflammatory, and antimicrobial properties show promise in treating rosacea. Aloe vera may also inhibit bacterial protein synthesis, making it difficult for bacteria to grow in its presence. People who use aloe vera have noted improvement in symptoms associated with UV-induced dermatitis, such as itching, burning, and scarring. Taking all this into consideration, aloe vera L extract should make a great candidate for caring and soothing rosacea-affected skin, the authors of the paper wrote. Study limitations. Although the paper shows great promise for people experiencing rosacea, the researchers said their findings have several limitations. First, they may be limited due to the lack of standardized methods for determining the severity and treatment efficacy. Additionally, many studies only report changes on global rating scales and don't describe improvement in symptoms. Botanical extract formulations are also not standardized and have not been clinically tested. However, the researchers said their paper provides a complete picture of active botanicals that may help rosacea and opens new avenues for research on natural compounds in the management of rosacea, alone or in combination with consecrated drugs.